Welcome to the Peak Performance Podcast, your guide to optimizing your life one health tip at a time. This podcast is designed to entertain and inform, not to provide medical or health advice. Always consult your doctor when it comes to your personal health or before you make any changes to your diet, exercise, or lifestyle.
Oh my goodness, it's the Peak Performance Podcast, ladies and gentlemen. Sorry, we were just taking a quick cat nap because we film 4 at a time now. That's a little ridiculous, Dr. K.
It's your fault.
Yeah, it is kind of
because Kyle refuses to move to West Palm Beach, and he will only come down 1 week a month.
That is fair, and I don't think the audience can appreciate how much mental power it takes to record a podcast because it's like brain on 100% the whole time.
Yeah, and there's 4 different topics that are completely unrelated. Like if you watch 4 of our episodes in a row, the chances are the last 4 are recorded the same day, and so. But anyway, enough about us. No one cares about us, except their mothers.
Yeah.
Thank you, Mom.
Love you, Linda. So what are we talking about today?
Procaine.
Procaine.
Yeah, the numbing agent the dentists use to numb your mouth.
Okay. So, like, this is a recreational drug, or what? What are we doing this for?
No, Procaine. Procaine is hands down one of my favorite IVs. It's been around a really long time. They started doing studies on it in the 70s and probably even before then. But no one wrote stuff down about it.
What is Procaine?
Procaine is literally Novocaine. It's a numbing agent.
Okay.
But when you inject it, yes, it's just a numbing agent. But when you put it in IV, it goes through fancy medical words incoming, sodium voltage gated channels. Closed medical words. What that means, it has a bunch of crazy effects in the brain and the bloodstream and the whole body. So the main thing that I use Procaine for is mental health, anxiety, depression, PTSD. The secondary benefit I use it for is neuroinflammation, like nervous system inflammation and whole body inflammation. The third benefit is that it actually suppresses tumor growth in cancer.
Wow. That's a list of benefits there.
Yeah, and that's just like the top 3 of it. Procaine has almost as many mechanisms of action as methylene blue.
Wow.
It's just no one knows about it.
So this is a bit of a landmark topic for us because this is, I think, the only thing we've talked about that I have not tried. I have not done a Procaine IV yet.
Well, that means that during our next filming session, we'll just hook you up to Procaine. Except that'd be a horrible idea because what Procaine does is when we put an IV, it will go into your brain and basically, here's the study. They put people on Procaine and put them into a PET scanning device or a PET scanner, I guess. It's like a CT scan, but it can measure active uptake in your brain. And so it flashes like red and green and blue and all these colors. And so to summarize the study, Procaine basically resets the brain. The amygdala and the hippocampus specifically, which are the emotional regulation centers. But non-medical words incoming, it makes you feel really drunk or high when you're doing it. And just for the length of the bag, it wears off by the end of the bag. But he would not be able to record the podcast.
No, I'd be all over the place. So if it has all these benefits, before we get into kind of more detail about the benefits or why someone would want to try this specifically for them.
Yep.
Contraindications. Why should you not use Procaine?
So there's allergy to Procaine. There is there's a few medications you take. They have to be careful with it. A couple blood pressure medications, a couple heart medications. If you have significant heart issues, there's something like if you have heart issues and they're not controlled by medication, 5% of those uncontrolled people will have a reaction involving profuse sweating and palpitations. And that's literally the extent of the reactions. So it's really a pretty benign thing as long as you stay in safe and allowable doses.
Well, that's a good segue. So talk to me about doses because I order the stuff, you sign the little bottom of the order thing, but I write out all the stuff and it says on the bottle 2%. So do we actually just give 2% solution or 2% Procaine or is this a milligram dosage? How does this work?
So Procaine comes in 1% and 2%. And forgive me, I don't actually know what that correlates to in milligrams of like per milliliter because we just think about it as 1% and 2%. And yes, we buy this stuff in super bulk. It's probably actually our number 1 bottle order, right?
Yeah.
Because I really love this stuff. I have a lot of patients doing it. So that 2%, or actually I do know it because I'm
Yeah.
about to tell you. It's 5 milliliters of it is 100 milligrams. So I can't math.
That's a bottle, right?
No, 5 milliliters. A bottle is 20 milliliters.
Okay.
So I guess it's 20 milligrams per milliliter, actually.
Yeah, there you go.
So there we go. I did math. The math came out.
So a whole bottle is 400 milligrams.
Yes.
Okay.
So we don't typically dose that high. So what I used to do, and now, so I've been doing Procaine now for almost 3 years. I have no idea how many bottles. I've gone through hundreds at this point. And so I used to start 100 milligrams, and then if you didn't report back to me in the next couple of days, hey, I actually feel better. I had emotional releases, my anxiety's under control, my depression's under control. Then we'd have you come back and do 200, and then either it worked or it didn't, right? What I've learned now is you get what's called negative effects when you're dripping Navy, and that's that drunk and high feeling. If you don't feel those, the Procaine's not going to work. And so now I've learned that I can adjust your dose on the fly. I look for things like nystagmus, eye position control, just overall talking to you and seeing how you're feeling. And then from there, I can adjust your dose on the fly. So I might start you with like and truthfully, I've learned how to talk to people now to even preclude, oh, okay, I know you 100 milligrams isn't going to work on you. We have to jump straight to 200 or 300 milligrams.
Mm-hmm. So what is like max dose?
I won't go above 500.
Go above 500.
My philosophy, what I've really learned is if 300 to 400 doesn't work on you, 500 probably won't either.
Okay. It's just not going to work. So it happens in some people where they're just immune to Procaine? Like, what is that?
Yeah, I don't think they're immune. Truthfully, everyone that I've done it on that doesn't have a reaction has used and abused recreational drugs. More specifically, a lot of them have used and abused cocaine. And so I think overusing cocaine does something to the brain pathways that Procaine won't be able to affect it, because cocaine is much stronger than Procaine and they're in the same family.
So let me challenge you on this one.
Mm-hmm.
My mother, who has not used and abused cocaine, last time she was in here, I think she did 300 milligrams with no reaction.
Yep.
She's just an outlier.
Your mother is an outlier to literally everything we do. Sorry, Linda. Nothing affects her. IV stem cells don't affect her. EBU doesn't affect her. Chelation doesn't affect her. Nothing affects Linda. And so PRP does not affect Linda.
Yeah, which is impressive because PRP hurts.
Yeah,
like
so,
I'm over here screaming and she's just like
yeah, so yes, she's an outlier.
Okay.
Long answer short.
Gotcha. So if you're not feeling it in the chair, you're probably not going to get the benefits.
That's what I've learned, yes.
Okay, so tell me about these boosters I hear about.
So I call them Jumpstarts. That's my little term for them.
There you go.
So some people are really mentally strong. And so, especially a lot of our patients, we have high-level performers coming in here. And so their brain is going to fight the effects of Procaine. It doesn't want to go down and be reset. So what I'll typically do, and I can typically seek out who that's going to be, Kyle, yes, he needs a Jumpstart. I can tell you that immediately. So what I do is, let's say I'm going to give him 300 milligrams. I'll load 250 into a bag. I'll let about 100 mLs of the bag, of a 500 ml bag, I'll let about 100 mLs drip into him. And then I'll look at him. I'll check him for nystagmus. I'll see if he's fully with it and it's not affecting him in the slightest. Then I give him what's called a Jumpstart, which will take another 50 milligrams and do a slow IV push with it. And what it does, it's such a concentrated dose coming in so quickly, it forces him to shut down.
And then basically, once that's tipped, the rest of the drip can just carry it.
Yep. The slow stream of it coming in will maintain it.
Okay.
And what's cool is typically what I tell people is watch your bag. It's a 500 ml bag, so it's staggered 1, 2, 3, 4, 5 with little designators. You'll start to feel it once it gets below 1. It'll wear off right when it hits 4. Always.
Sorry, I'm just going to close my methylene blue IV. So when we're doing this, what can people expect in terms of results and in terms of number of treatments? Like, is this something I need to do, I'm a one and done, or is this I need 50 or I need a regular treatment?
It varies is the answer. So like the COVID anxiety, I don't know if any of our listeners have experienced the COVID anxiety, which is you get like almost PTSD like symptoms after COVID. Usually one treatment of Procaine knocks it out. But now if you have true anxiety, depression, PTSD, usually in this series, and what happens is the first time you do it, it'll last a couple of days. The second time you do it, it'll last 3 to 5 days. And the next time you do it, it'll last like 1 to 2 weeks. And so it will start to last longer and longer each time. And so usually it's between 5 and 15 treatments. What happens is I'll do like a series of 5, 10, whatever on a patient, and then they'll disappear for like a month or two. And, we'll call them and be like, hey, are you coming back? We haven't seen you in a while. And they'll be like, no, I'm good. I don't need any more IVs. I feel like my anxiety, depression, PTSD, whatever is under control.
Very cool. So do those people ever come back in like 6 months for just a touch up?
Only if they really enjoy Procaine. Some people find the feeling of Procaine very enjoyable. Some really don't. So there are people that enjoy it and they come back just because they enjoy it.
I would not be one of those. I hate anything that brings me out of focus.
Yeah, but for some people, they're so focused that they literally cannot turn their brains off and they need that break.
That makes sense. So for Procaine, tell me more about like anxiety and that treatment.
Yeah. So anxiety is like your brain is stuck reading the same book over and over and over and over. And depression's in that same vein, but not quite the same. But so what happens is your brain refuses to put the book back on the bookshelf. So what Procaine does is it forces your brain to close the book, put it away. It doesn't stop you from picking the book back off the bookshelf if you really want it back, but at least gives you that opportunity to break free.
I like that. So can we talk about cost for a little bit? Because this sounds like a fancy longevity treatment that could be expensive.
Well, at the longevity center, nothing's expensive.
And when we say nothing's expensive, that is relative.
Yes. Compared to everyone else.
Yeah.
You can probably find it here for less.
Yeah. So what is like an intro dose or starting dose?
So truthfully, as I've learned, like I said, I used to start at 100. I almost never do 100 milligrams because for the majority of the people, it's not enough. And there's no downside to going higher. So I normally start people between 200 and 300. I don't actually know what we charge for it. Do you?
Yeah, it's somewhere, depending on dosage, is anywhere from like 140 to 200 and something.
Yeah.
An IV, which, like you said, probably you need 5 to get the long-lasting results.
5 to 10, just depends
10.
how bad you are coming in.
Yeah.
And now I want to put a little asterisk on that because I want people to realize, okay, sure, it's $150 to $200. If you're seeing a psychologist or a psychiatrist, you might be spending that per month anyway.
That's true. Yeah, that's a good point because they're $150, $200 an hour.
Yeah.
Yeah. That makes a lot of sense.
And if you're doing EMDR, you're probably spending even more.
Yeah. So would you stack this with something like a psychologist or EMDR or something like that?
Well, you just touched on our next guest, Dr. Kim. Dr. Kim is a spiritual counselor, and so that's why she's here. Because people that need help beyond the Procaine, they'll do Procaine, kind of realize what their problem is, and then they'll get with Dr. Kim and do sessions to actually talk through their problems.
Yeah, because you don't want me or you doing therapy on people.
No. Have you seen this face? You want this face looking at you while you're talking about your problems?
I tell Dr. K is a resting thug face. If you just catch him just chilling out, he's like... So, Procaine. You've used Procaine on my injections to numb me up, right? Before?
Truthfully, I only use Procaine to numb up injection sites if I have a syringe of Procaine left over at the end of the day and you're my last patient.
That's fair. So, besides like an IV drip in a bag... Are there any other applications for Procaine?
Yes, there's 2. There's one called neurotherapy, and we're going to save that for its own episode. But basically, neurotherapy is using wheels of Procaine to reset peripheral nerves. And then there's SGB, Stellate Ganglion Blocks. These are becoming a bigger and bigger thing because it's a vagus nerve reset. So it's a shot in the side of the neck, right towards your stellate ganglion. Not painful. Unless you're really scared of needles, not scary. I do it under ultrasound. There are people that also do it under fluoroscopy. I vastly prefer ultrasound because then I can see the vessels a little bit better. It's a little bit of a more precise approach, honestly. Those originally developed under fluoroscopy. But what it is, it's Procaine is injected right around the stellate ganglion block, or stellate ganglion to create a block of it. And it's the same idea. It's going to feed up into the brain and force a reset of that fight or flight response. That's what the SGB block is really for.
So the stellate ganglion is a collection of nerves, correct?
Yes, it's a nerve cluster.
So basically it's part of your CNS, so your central nervous system.
Yes.
And so the thought is if we can hit this area with a calming agent, a numbing agent, if you will, it will reset that central nervous system and help drop the fight or flight response.
Yes.
So why would you do this over something like a Procaine IV drip?
Truthfully, for people that need it, I do both. You do the SGB and then you go into the other room and do a Procaine IV to really hit your brain. The SGB is stronger. If you have that high drive anxiety, the SGB is much stronger and a quicker response than the Procaine. You usually still do need a series of SGBs, but if you're really bad, the SGB will pull you out much faster than the Procaine will.
Okay, that's very cool. So people can expect you to do one side at a time, two sides?
Yep. So the way it's done, it's day one, you do one side, and then you come back the next day, and a couple of days later, you do the other side. The phrenic nerve that controls our diaphragm is right next to the stellate. So the concern is if we numb the phrenic nerve on both sides at the same time, you won't be able to breathe. So we numb one side, that way your diaphragm still works if the phrenic nerve does get numbed. That's why it's a 2-day procedure.
That makes sense. So come in one day, do one side, come in the next day, do the other side.
Yep.
What can people expect to feel after that as opposed to like after a Procaine IV?
Yeah, so after Procaine IV, you hop in your car and you go home. You're back to normal for the most part. Some people have a little bit of dizziness. After SGB, you have to have someone drive you. First, you're going to get what's called Horner syndrome. You're going to get a very dry eye. It's going to turn very red. Your eyelid's going to get very droopy. Mentally, you're going to feel extremely slowed down. Very mellowed out, very calm. You cannot drive. Your reaction time is significantly decreased.
So how long does this last? Because those don't sound like favorable effects, right?
No, the Horner syndrome typically lasts anywhere between 20 minutes and an hour.
That's not bad.
The extreme mellowness can last up to 6 hours. And so it's not the end of the world. Just by the time you wake up next morning, you're back to normal.
Okay, so it's kind of like waking up from anesthesia.
Sort of.
Yeah, probably a little less.
Way less.
Okay. Yeah. So those things you said they're more powerful. So a series of these might not be 5 to 10. It might be less for most people.
It depends. The range for SGBs is 2 to 20, truthfully.
2 to 20.
Yeah, because the SGBs, they've done so much studies. SGB started as a way to get like special forces operators back into war. And so if you're getting something like that, you're going to need a lot more than the average person that's like, I don't know.
Stressed out about the work email.
Yeah.
Gotcha. Yeah, there's a big difference between bombs coming down on your head and work emails.
Yes, and that's why the range is so big.
Gotcha. So, and I think it's probably a good distinction to make that the people who do SGB are the people who really need it, right? Yes. The people who are like, if you have mild anxiety, you probably wouldn't go for the SGB. You probably just do the Procaine drip.
I'll still offer if they really want it because it's like I said, it's a faster turnaround.
Mm-hmm. That makes sense.
Mm-hmm.
Yeah, because if they have very mild anxiety, one SGB might do them wonders, as opposed to 5 Procaine IVs.
Yep.
Okay, that makes sense. Yeah. So pricing on an SGB block?
That's where the longevity center comes into play. Average price for an SGB block is between $1,000 to $2,000 per side. That means you're spending between $2,000 and $4,000 per procedure, per total procedure. What do we charge?
Less than that.
The answer is always less than that.
I don't actually know off the top of my head.
I just adjusted the pricing recently. It's $900 for both sides.
So
both sides, so $450 per side.
So 25% roughly.
Yeah,
that's like a huge savings.
Mm-hmm.
So why do people charge this much?
Because they can.
This goes back to the stem cell discussion we had about pricing.
Mm-hmm. There's not that many people that know how to do it. It's one of those things. If you're not extremely good at ultrasound and needle placement, it is a very difficult procedure. If you're really good at both those things, it is a quite simple procedure.
So obviously what you do almost every day is ultrasound guided needle placement.
Yep. Yeah. Compared to doing a high cervical injection, doing a stellate ganglion block is much easier.
Okay. So this is not a difficult procedure for you to perform.
Not at all.
How long does it normally take?
For me to do the procedure?
Mm-hmm.
I don't know, 10 minutes.
Yeah. So 10 minutes, and then I imagine they sit in recovery and wait for a few minutes.
Yeah, everyone hangs out it's a 10-minute procedure. You always hang out for 20 minutes afterward just to make sure you're doing okay.
Okay. Very cool. Are there any contraindications that are different for the SGB than?
No, it's actually less because it's not whole body. It won't affect your heart.
Gotcha. Very cool. Anything else anybody should know about this treatment?
It becomes an individualized response. Again, for a general discussion, I think that about sums it up.
Excellent. So if you want more information, please give us a shout or comment on any of our platforms. This was the Peak Performance Podcast with Coach Kyle, finishing my methylene blue drip, and I'm here with Dr. K.
Thank you, everybody, for joining us. We'll see you guys next time.
Adios.
Thanks for tuning in to another episode of the Peak Performance Podcast, your #1 resource for today's top health hacks and facts. You can follow us on Instagram at Peak Performance Pod or on X at Perform Pod. You can also check out our website and weekly blogs at peakperformancepodcast.online. Again, thanks for watching, and don't forget to subscribe. We put out a new podcast every Thursday. The content of this podcast is provided for informational purposes only and is not intended for the purposes of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider. Carefully read all labels and heed all directions and cautions that accompany the product. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Coach Kyle, Dr. K, and producers, disclaim responsibility for any possible adverse effects from the use of the information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.